to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're talking about a question that so many patients living with chronic illness quietly ask themselves. How am I still struggling with this? You've seen the doctors, you've followed treatment plans, you've tried medications, you've made lifestyle changes, and yet the symptoms are still there. Progress feels slow, and daily life can still feel overwhelming. If that resonates with you, then this episode is for you. So joining me today is Christine, a member of our team. Welcome, Christine. How are you?
I'm doing great. Thank you so much, Dr. Borrelli, for having me here. So why is it that even after doing, everything right, patients with chronic conditions can still feel like, they're struggling?
Because chronic illness is rarely simple, and healing is almost never a straight line. And so chronic conditions often involve multiple factors, for example, physical symptoms, emotional stress, medication changes, sometimes conflicting medical opinions. Many patients see several specialists who focus on different pieces of the puzzle. Healthcare systems are designed to treat specific issues, but chronic illness doesn't always fit neatly into one specialty or one appointment. As a result, patients are often left managing this bigger picture on their own, while already not feeling well.
Right. That stuck feeling is something we hear about a lot. So why does that happen?
Over time, managing appointments, tracking symptoms, coordinating between providers, advocating for yourself, it becomes really exhausting. And so patients start to wonder, am I missing something? Should I be further along? Is this just how it's going to be forever? But feeling stuck doesn't mean that you're failing. It often means that you need more coordinated support and a clear plan. Sometimes progress happens when someone steps back and looks at the entire healthcare journey, not just one symptom or one visit at a time.
You're absolutely right. So for someone listening who feels, frustrated or even discouraged, do you think that is normal?
It's very normal. Living with chronic illness is physically exhausting, but it's also emotionally draining. There's uncertainty, unpredictability, and there's often a lack of clear answers. So many patients internalize that frustration and think it means that they're not trying hard enough. But chronic illness isn't a personal failure. It's complex biology intersecting with a complex healthcare system. Acknowledging that complexity is so important.
I agree. So this is where private patient advocacy can really make a difference, right? So how can private patient advocacy help someone who feels stuck?
Absolutely. So, private patient advocacy focuses on the whole person, not just the diagnosis. At Pathway Patient Advocates, we help by organizing medical records and treatment history, preparing patients for appointments so concerns are clearly communicated, helping them understand treatment options and next steps, coordinating communication between multiple providers, supporting second opinions or specialty consultations. When you're overwhelmed, having someone experienced in your corner can help you regain clarity and control.
So you mentioned coordination earlier. Why does coordination matter so much in chronic illness?
Because chronic conditions rarely exist in isolation, different specialties may treat different symptoms, but someone needs to look at how everything connects. So, without coordination, patients can receive fragmented care. Tests may be repeated, recommendations might conflict, so important details can get lost. But when care is organized and communication is streamlined, patients often feel more confident and less overwhelmed. That clarity can make a meaningful difference in how they move forward.
So if someone listening feels like they have done everything and they're just tired, what would you want them to hear?
You're not alone. Struggling with a chronic condition for months or years does not mean that there's no path forward. It may simply mean that you need more support. Sometimes the next step isn't another medication, instead, better organization, clearer communication, or a fresh set of eyes on your entire history. At Pathway Patient Advocates, we help patients living with chronic conditions make sense of their care, ask the right questions, and move forward with greater clarity and confidence. You deserve to feel heard. You deserve guidance, compassion, and a plan that makes sense. And you deserve to move through healthcare with support.
I love that. That very well said, Dr. Borelli. So, for anyone looking for help for themselves or for their loved ones, there are so many ways to reach out to us. You can give us a call at 947-517-8395.
Thank you, Christine. It's been a pleasure, as always. I hope this conversation helps our listeners feel more confident as they navigate their healthcare journeys. Have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.